Hi, good
Hi.
afternoon. And with me today, we have Sylvana Sinha, who is the founder and chairman of Praava Health, a health tech startup based in Bangladesh. Sylvana, great to have you here and very excited to learn more about what Praava does.
Thank you so much for having me, and wonderful to see you always, Lathika.
Yes, great. So, Sylvana, we are very, very glad to have you as a part of Project Amplify, a joint program between Microsoft and Accenture, where we look at engaging with promising startups that are focused in social impact and who are looking to solve, large problems, which I know that Prava is trying to do in the area of health. Uh, Tell us more about why you started Prava.
Sure. So I actually had not worked in healthcare before I started my company. I had been visiting Bangladesh for a family wedding when my mother was hospitalized for a basic procedure, and it was extremely eye-opening for me. We were very lucky to be in the VIP suite of one of the fancy private hospitals. But despite that, the surgery was delayed, and then there were a lot of complications afterwards, requiring us to airlift her to Bangkok, where she had another surgery, and then she had a third surgery a year later in the United States. And this just really struck me that despite the tremendous progress that Bangladesh had seen in my lifetime, Bangladesh has been one of the fastest growing economies in the world for a long time. In the last 2 years, GDP per capita has exceeded India's. Despite all of these things, it appeared that no amount of money could afford you access to excellent quality healthcare. So that was a problem that I felt merited further investigation. And I didn't know if, it was a very humble thought that I might be able to do something to influence that. But that was really the beginning of my journey. We came to build the company in the way that we did for a couple of reasons. I think around the time that I, decided to start the company, it was around 2014. And everyone was obsessed with this concept of building Uber of things. And a lot of people said, why don't you build Uber for healthcare in Bangladesh? And I resisted that. I resisted that because I think Uberov works where you have a strong underlying infrastructure. And unfortunately, across low and middle income countries, we don't often have that infrastructure. And in countries like Bangladesh, you actually have more people dying due to lack of access to quality healthcare than lack of access alone. And so the Uber of model really only solves for the access problem. And so what we've done is we've built what I like to call a click and brick healthcare model, whereby we have built both the infrastructure and the technology. So our model is a fully vertically integrated outpatient care model, a one-stop shop for all of your outpatient care needs, either in clinic or at home.
No, it's interesting. I really like the click and brick model because I think technology solves a great lot of problems, but there are certain areas where you need the touch. You need the ability to speak to a doctor. I don't think that I would want AI to drive all my problems. You already have the internet today, and everybody is a WhatsApp doctor or get stuff on the internet. Clearly, of course, what the what technology does do is that help you understand better early on, some of the trends that are going on with your health. But I think the fact that you have understood that you need to actually have the click and brick, model makes complete sense. What's interesting is that it really is the basic form of healthcare, all over the world today, right? In terms of having, you have your own mini hospital, if I may say so, with this diagnostic lab. You've not kind of, tried to build large the hospitals, but that is something that also is replicating what doesn't exist. And are there any kinds of efficiency that you're seeing as a result of using technology, right? Because how many brick and mortar, I would say, pop-ups can you have across Bangladesh, right? Because at some time you won't be able to manage with a small 10,000 square foot clinic. You'll need to go into the 100,000, 500,000 square foot hospital. So just curious about what your thoughts and how your model is going to work.
Absolutely. No, that's a great question. So I think what's so exciting about working in healthcare now is this interplay between the technology and the infrastructure, right? So technology solves the access problem. That's very obvious, right? I can go on my phone, order drugs from Praava and have them delivered to my house later today. I can go on my phone, talk to a doctor. I can access my records on the phone. So the access problem, that's an easy one, really. That's the most basic one that I think many of us have been working on across the healthcare ecosystem. But what's more exciting is how do we use technology to improve healthcare outcomes, actually, right? How do we use technology to interact with patients, to help to understand what's happening with them, and to help prevent hospitalizations, help prevent escalations, and really help them at the moment that they need it so that they don't get to the point that they're so sick that they need to be hospitalized or worse. And so that's really where we're headed. I think already with Praava, we've seen that through ongoing outpatient care and access to care, through ongoing interaction with doctors and reporting, even at-home self-reporting, we've been able to reduce hospitalization rates for members, of our system. And that's just the beginning. There are people who are doing some really interesting work that we're even exploring some partnerships with in terms of using remote sensors for post-op patients to reduce rehospitalizations for them. And that same concept can be used for chronic disease sufferers as well. Even during COVID, we've built a tool for remote management of COVID that's been able to reduce hospitalization rates by a third. In our part of the world, across Asia, right, we're very hospital centric. Anything goes wrong, we feel we have to go directly to the hospital. But that's not the case, in fact, right? Healthcare is moving from hospitals into clinics and into homes, and that is what it should be doing, actually. Dr. Omar Ishraq, who's the chairman of Intel, former chairman and CEO of Medtronic, he says hospitalizations are the failure of healthcare, right? So if we're succeeding as healthcare providers, that means we're keeping people out of the hospital, and that's what we're really dedicated to at Praava.
No, I think that's fantastic. You're absolutely spot on. Like, I really don't want to go into a hospital and for anything. If I can, get my blood test, if I can get my basics taken care of, if I can actually go in and speak to someone, and today during the pandemic, I think all of us have gotten used to, speaking to your doctor on the phone or on a getting a video consult and actually being satisfied because it is what it is, and we've had to do. But so I think you're really in the golden era of healthcare and technology, kind of being adopted to scale. My last question for you, Sylvana, is that you've been in this. It's a new space, and something like healthcare and education is something that you can continue to doing it for the rest of your life and still feel that you haven't made a dent. So what do you believe are some of the challenges that you face in Bangladesh, that you hope will come in place for you to be able to scale what Brava does?
Well, we've talked about this, Lathika. My biggest challenge is access to capital. I'll be frank, there's a lot that's said about the need for investment in healthcare globally. But unfortunately, if we look at the numbers, most investments happening in healthcare in the last few years have happened in advanced economies like the United States and Europe and China. Unfortunately, although we've lived through this global pandemic where we know how integrated our world is, the investments to build up infrastructure in our markets, the investments are just simply not happening at the rate at which they need to. And so my biggest impediment to scaling our work is really capital. I mean, we've done very well independently on our own through raising relatively small amounts of capital. We raised more than $11 million from investors, but And we've grown very quickly. We just actually registered our 300,000th patient yesterday. So we're very proud of what we've done. But in order to really reach the next level, in order to take over healthcare in Bangladesh, which is our ambition, and even beyond, we'd like to scale throughout the region, we do need investors to understand both the need from an impact perspective, but more importantly, there is a substantial financial opportunity here. Disposable incomes are rising in our region, and when you talk about healthcare and education, any one of us, when we have more disposable income, those are the two things we're immediately willing to invest in for ourselves and for our families.
Absolutely. Great. I'm very, very bullish that you will find the capital that you require, because I think that's really, I think most investors recognize that this is the opportunity, right, in terms of
Absolutely. I'm sure we're going to get there.
affordable healthcare. And we were very excited as as part of Project Amplify that we can work with Praava, really leveraging technology to get you to scale, because that's the only way you're going to scale. And so we're here to help you and help you through this journey. Good luck, and we look forward to working closely with you.
Thank you so much. We're so honored to be part of the community.
Great. All right. Thank you.
Thank you.
Cheers. Bye.